The Stars and Stripes show is brought to you by the U.S. Embassy.
It's Gabs FM, powered to engage your world. And of course, welcome to the Stars and Stripes show, proudly brought to you by the U.S. Embassy. Kings and queens, listen up. The American people did see it fit to answer the call in terms of our HIV/AIDS epidemic or pandemic, and the U.S. President's emergency plan for AIDS relief, otherwise known as PEPFAR, which is the U.S. government's initiative to support partner nations such as Botswana around the world in responding to HIV and AIDS. It is the largest commitment by any nation in the history to combat a single disease internationally. And since then, let me tell you, PEPFAR's inception, Botswana has received more than $706 million in health assistance from the U.S. government to fight against HIV and AIDS. And that's why this show is important. And of course, today, we are celebrating the anniversary of PEPFAR, 20 years of impact, 20 years of shared health. And of course, in the building, I have none other than the Chargé, Mark Weinstock, to speak about the Meet America policy segment. What up, Your Excellency? How are you?
Good, and thanks for having me on the show today.
Thank you, sir.
I really look forward to talking about this program and sharing a lot of great information. And of course, I hope the audience also enjoys what we're going to talk about today. But honestly, thank you for having me on the show.
Absolutely. I think, in my opinion, health is the backbone of society. You know, a healthy society, such an important, coming out of the pandemic, etc., we can see the importance of a bilateral relationship that speaks to the health of a nation. It's very of vital importance. But
absolutely.
Look, Your Excellency, I'm going to call you Your Excellency throughout the show.
Feel free to call me Mark. I'm happy with that too.
Mark, let's go into it. Look, someone's listening and they don't know the history of PEPFAR. They don't know what PEPFAR is. They don't know what is the story behind the rationale around PEPFAR, why it was created, how it was created, and why. Walk us through that journey.
You know, it's a great segment, a great start to this conversation. It gives me the opportunity to talk a little bit about the history of PEPFAR and actually why we were here today to talk about it. So let's be honest. Tomorrow, January 28th, is the 20-year anniversary of PEPFAR.
Jeez.
So what does PEPFAR stand for? PEPFAR stands for the United States President's Emergency Plan for AIDS Relief.
Okay.
This was restarted in 2003. So when you're talking about, 20 years ago in 2003, we're talking about the U.S. administration under President George W. Bush. So he was the one that initiated, inaugurated, developed, and brought into fruition what we know today as PEPFAR.
Wow.
So what is PEPFAR doing? PEPFAR is making the fight against HIV/AIDS a priority of our U.S. foreign policy, providing financial support to assist our partner countries in offering prevention, testing, and care and treatment services to those living with HIV. So let's start with a very interesting fact here. PEPFAR has saved more than 25 million lives across the world.
Sure.
Hey, amazing, isn't that? That's just really an astonishing number.
Wow, 25 million?
25 million, isn't that? It's really amazing.
That's amazing.
So it's a really good program, but what is PEPFAR doing? PEPFAR is working with partner governments, such as the government of Botswana and others. And so over the existence of PEPFAR, over the last 20 years, PEPFAR has truly, completely transformed the lives of people living with at risk for HIV. PEPFAR is fostering hope, dignity, and health security now and for generations to come.
Wow.
I also want to point out that PEPFAR has been around for the last 4 U.S. administrations. And I know we talked about which presidents they were, but I'll let you know.
Let me know.
And, we talked about 20 years ago as George W. Bush.
Wow.
And then from there, it went to President Barack Obama, then to President Donald Trump, and to where we are today with President, who I like to call Big Joe Biden. And so this program has been around for all these administrations. It's had the support of our Congress. It's had the support of the people of the United States, and definitely has the support of the people of Botswana and everyone else around the world. So great question, and I hope that filled all your questions.
No, definitely. You know, my experience, Mark, with HIV and AIDS, being a young person, I was a little one. I was about 8, 9, I think, when it really broke, and we heard of the concept of HIV and AIDS and the stigma around it, and don't share a plate with somebody, and we all had a Hona Botswana who can say they did not have a loved ones who was either infected or affected, you know. But, you know, when you fast forward to 2023, I must say the brand awareness, the education reached the corners of Botswana, whether you're from Marapong, Molepolole, or Gabs, you know, and you can see that the collaborative effort, you know, sometimes we tend to forget that, you know.
Yeah,
the other day, last year, I was at a secondary school and I was walking through the school. I saw a sign on one of the old walls, and you could see how old it was, but it was still communicating about HIV and AIDS. And today we have a healthier population. So, you know, we've got to thank the BW government. We've got to thank the American people and the US government, including PEPFAR. And that is what PEPFAR means, you know, whether we like it or not. Mothers can give birth to children. You know, you underestimate that kind of impact and what it means to a family, what it means to the health of a family. So that's brilliant. Shout out to the American people. Shout out to the BW government. Shout out to the US government. Look, why is the 20th anniversary a big deal for the US Embassy here in Botswana? And why should it matter to the people? Why should we care about it? You know, and this is why, you know, young people, especially the new generation, don't know that we had a serious challenge. Walk us through.
No, actually, you answered the question yourself. I mean, we should all be very proud of this day, January 28th, and celebrating this. I mean, I believe many of us, you know, who are in a little bit of an older generation, have experienced and seen loved ones who have been affected with HIV or AIDS. And to this day, we continue to fight, and this culmination of 20 years really supports what we are doing. And when I say we, I'm not just talking about our government. I'm talking about the people.
Yeah,
people of
absolutely.
Botswana and the people of the United States.
Nice.
But actually, for you in the audience, you know, PEPFAR remains the largest commitment by any nation in the world to address a single disease. As a consequence, we are witness to how targeted programming, investments, and partnerships have changed the course of the pandemic. So, what does that mean? Really, we are reversing HIV from a grave diagnosis to a disease that can be prevented and managed with patient education, equitable access to HIV testing, effective treatment services, and functioning health systems. You know, Botswana remains, and actually Botswana represents one of the great success stories of how collective action during our 20 years of partnership changed the course of the HIV response.
Absolutely.
You know, at the peak of the epidemic, Botswana faced a HIV prevalence rate as high as 30% in 1999.
Sure.
But today, HIV prevalence has declined to approximately 20%. We also talked earlier, you mentioned about, you know, mothers having babies. Here's another interesting fact.
Yes.
So less than 5% of babies born to HIV positive mothers have contracted HIV. This is a low number, and it's really great. Also, 98% of the people who know their HIV status are on life-saving treatment. You know, because of this vital partnership with the government, and let's not forget the people of Botswana, the private and public organizations, civil society, non-governmental, multilateral organizations, and let's add it all together, and other stakeholders. You know, Botswana is on track to end HIV/AIDS as a public health threat by 2030. I mean, that is very significant. This target is within reach and will be a tremendous accomplishment for our partnership and our relationships that we have together. So let's be honest here. PEPFAR support to the government of Botswana has played a critical role in strengthening the health systems over the past 2 decades to ensure the health system is equipped to provide critical prevention and treatment services and monitor the response to ensure that we are providing high-quality, patient-centered services to those impacted by HIV/AIDS. You know, our partnership is strengthening the local health systems to ensure equitable access to services and ensuring programmatic successes are sustained long into the future, hopefully after we're all gone
And you know, that's actually my favorite part about the initiative. I'm a firm believer in teach me how to fish. You know what I'm saying? And,
Let's
you
go
know,
fishing.
capacity building and, capacitating our clinics, our health workers, our systems, our policy is so important to, get rid of the dependency syndrome, for lack of a better word. So that's why you can, and for me as a Botswana, that's how I can tell that, the motivation around this bilateral policy is a good thing and is genuinely, the genuine objective is to benefit the Botswana, because once you capacitate me, my friend, I can stand on my own. Brilliant. Thank you so much. Look, you did mention the BW government. Let's just touch on, PEPFAR's work with the Botswana government and various stakeholders involved, because whether we like it or not, there's a collaborative effort, and obviously the model of the citizenry and the BW government. Walk us through, that engagement.
With anything that we do as government organizations between Botswana and the United States, it's all based on strategic partnerships. So strategic partnerships are the cornerstone of the PEPFAR program. Botswana's response to the epidemic has always been strong and inclusive by ensuring communities, development partners, government, private sector, and civil society could all play a part in the response. Since its beginning, PEPFAR has supported Botswana's HIV response, providing more than $1 billion over the last 20 years. Along with funding PEPFAR Botswana through U.S. government agencies, meaning the U.S. Agency for International Development, Center for Disease Control and Prevention, Peace Corps, HRSA, and the U.S. Department of Defense, and with other implementing partners, we've provided technical assistance to the government of Botswana in areas of prevention, testing, and care and treatment.
Nice.
The support has also focused on capacity building for healthcare workers and service providers, and help to strengthen the existing Ministry of Health clinical and community systems, supply chain, laboratory, and data surveillance systems. Additionally, PEPFAR agencies have funded implementing partners to provide direct service delivery, complementing what the government of Botswana is doing, which entails focusing on closing existing gaps. Partnership and relationships and renewing partnerships and relationships is, like I said in the very beginning, key and the cornerstone of our endeavors and partners with PEPFAR. So it's been great.
I mean, I got to thank the BW government and our leadership in line with what they have done, because, a leadership that values health is a leadership that can be trusted, whether we like it or not. This is the multiplier effect. This goes to show the bilateral relationship between the U.S. government and the BW government. If you've had a loved one who is HIV positive, then you understand the impact of this kind of shared relationship, shared culture, and of course shared health. Allow me to take this call. Gabs FM, good morning. How are you? Hello? Hello? Well, 395-6962, please be a part of the conversation, and this is important. Kings and Queens, let's move along swiftly. Do you have anything to add? One thing that I love about PEPFAR is that it's an example of what I called the social sharing economy, an economic model in which goods and services and resources are shared by individuals and groups in a collaborative way, and you underestimate that. One thing that I love about the U.S. is that it shows the importance of diversity and collaboration, and it's evident in where the United States and the milestones the United States has achieved through that kind of, culture. And this is why the bilateral relationship is so important. Walk me through. Do you have anything else to add?
No, from a personal level, just being part of the culture here in Botswana, and learning about the different cultures and foods and musics and everything else, that's just a rewarding experience. And you just add the partnership that we have with the government of Botswana, as well as the people and the friends that I've made here. It's just created for a wonderful time to be here. And I know we've all been affected by the COVID-19 pandemic. But we are doing some good work, and many of us who are here on assignment with the U.S. government, we're grateful for the people of Botswana and opening up their doors and allowing us to experience the culture and the people of Botswana. But yes, and of course, any opportunity to discuss our partnership with the people of Botswana is hugely rewarding, and I do graciously, thank you for allowing me to speak on the show. But I would love to add that PEPFAR is at a pivotal moment in the global HIV response. Of note, it has been a real joy, for me at least, to see how PEPFAR has progressed and grown from a initial emergency, 5-year initiative designed to address approximately 1.8 million new HIV infections every year in PEPFAR countries to a long-standing program that has decreased new HIV infections per year by half, and AIDS-related deaths were cut by 64% by 2020. I mean, we can go on and on, but this program has done a lot for many people around the world.
Absolutely.
PEPFAR remains dedicated to supporting partner governments, ownership, and vision towards achieving, sustaining near universal prevention and treatment coverage of HIV/AIDS by effectively using local capacity, improving coordination, finding efficiencies, and supporting country priorities while maintaining HIV impact. Just in closing, and I said it earlier, thank you for having me on the show, but it's been really great to talk about this 20-year anniversary, which we're going to start celebrating today, which actually is really tomorrow, January 28th, and I believe we're going to do this throughout the entire time that I'm remaining here.
Nice.
For the next year, we plan to do a lot of different events and showcase not just really PEPFAR, but our partnership with the government of Botswana and the people of Botswana. So thank you.
Absolutely. And if you've just joined us, welcome to the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM, #America in Botswana. And today we're celebrating PEPFAR 20th anniversary, 20 years of impact. Remember, the hashtag is PEPFAR at 20. Kings and Queens, I got the Queen in the building, and I've never done this before.
She is.
But let me do this for the first time. You gotta understand, nobody gets drums, okay? Nobody has ever gotten drums.
I got drums.
Not the Sharjah, nobody. You get drums because you're in the building. Thank you so much. You've done a great job. And of course, if you're wondering who am I talking to, I'm talking to the PEPFAR country coordinator, Her Excellency Yemi Oshodi. How are you, Yemi? Welcome to the show.
Swift, I got drums.
You got drums, girl. Nobody gets drums. Nobody.
Thank you so much for having me. How are you doing?
I'm okay. How is you and your family and everybody?
So well, and literally so happy to be here.
Well, you know what? I think we have to applaud the human capital within PEPFAR, and within the Ministry of Health, and without human capital, there's no way that you could have achieved what you've achieved.
100%.
And I am so blown away by both the partnership between the U.S. government and the BW government. Walk us through, country coordinator. What's your role? What's your mandate? Just walk us through some of the things that Mark mentioned and echo, where you are.
Okay, sure. Thank you so much. Again, thank you for having me here, Swift.
Yebo.
And that's a great question. So, okay, what do I do as the PEPFAR country coordinator?
Yes.
So I work with the U.S. government agencies.
Okay.
And then I also work with the government of Botswana ministries.
Yes.
Basically just to make sure that our programs are running smoothly. So as you know, the U.S. government donates hundreds of millions of pula to Botswana every year. And so my job is to work with the PEPFAR country team, as well as the government and our stakeholders to make sure that there's a plan for every single pula.
Wow.
And to ensure that every single pula is optimally focused for impact.
Wow.
So that we can make data-driven decisions and so that we can ensure that our programs are innovative and that they try to reach every single person in the country. Another part of my job is to ensure that we are truly listening to the people of Botswana and to ensure that their voices are represented in the design of our programs.
Wow.
And that their needs are represented. So I get to work with I'm going to call them a phenomenal team of about 60 people in the PEPFAR country as part of the PEPFAR country team.
Wow.
They're mostly Botswana.
Yes.
And they work tirelessly towards that exact same goal.
And the results are evident. Whether we like it or not, the results of this particular partnership, you can't question them. It's an objective result. Whether you like it or not, it is extremely factual. Look, some of your priorities, I know that, PEPFAR has also by design got dreams. I know there's got a mentorship program. And one thing that I must applaud this relationship, it's informed by data. You're not shooting into the dark. You're actually getting the appropriate data and then applying a strategy for social change. Walk us through.
Exactly. So we have so many priorities at PEPFAR, but you hit the nail on the head. Data is everything for us, right? It's a huge priority. But okay, I'm going to throw out a bunch of P's here, so please bear with me.
Yeah.
Okay, the first is progress, then populations, and then PEPFAR leadership.
Okay.
Now, let me just go through each of those priorities for a second. I'm actually going to start with PEPFAR leadership. So I just have to mention our PEPFAR leader, our current PEPFAR leader, our new leader. His name is Ambassador Dr. Nkengasong.
Okay.
And he joined us last year. And he's amazing. He's the first person of African descent to lead PEPFAR ever.
Wow.
And he is ensuring that we are truly listening to our host countries, like Botswana, so that we really drive the programs, so that they really drive the programs, and so that they really lead the direction that we move in.
Nice.
And I get excited just thinking about what that means for PEPFAR and for ending HIV as a public health crisis. It's all about respect and it's all about humility. So the best way I can put it is that our PEPFAR priorities are just the same as the government's priorities and those of our stakeholders. Things like achieving health equity for priority populations through valuable programs like the one you mentioned, our Dreams program, to ensure that we're empowering adolescent girls and young women to prevent them from being exposed to HIV. Other priorities include health system strengthening, and to provide ongoing surveillance of HIV and other global health threats. So now for the next P, which is progress. So when PEPFAR was launched in 2003, kind of like you mentioned earlier, as so many of us know, an HIV diagnosis was a death sentence in much of the world, including Botswana. Entire families and communities were falling ill. Since that time, for so many people, that time of death and despair has overwhelmingly been replaced by vibrant lives and by hope. The Chargé said it so well earlier. He said that through PEPFAR, we've saved 25 million lives and prevented millions of HIV infections. Working together with government and with our other partners, we want to build on that same progress, community by community. And then our last P is populations. So PEPFAR works to reach the people that are most affected by HIV with innovative solutions that try to meet their needs. As a result, our partners who are working all over Botswana, from the northwest district to the southern district, to ensure that people have access to HIV testing, to treatment, and to other services to enhance their lives.
Absolutely. One thing that I also I pick out is that you haven't spoken and told the Botswana people and told them what to do, but you're saying, let's sit at a table and plan and collaborate. And I think that is, you underestimate that, you do not want to undermine your partners. It's so important to say, look, we're in it together and this is what we can do to move forward. So I think
exactly
for me, that is very, it speaks to the respect factor. We got to respect each other. And, the psychological principles you spoke about, humility and integrity, especially in the HIV and AIDS, are so important. The psychology of health it's so important to get to the promised land. Look, let's talk last year. I know last year was big for PEPFAR. We had the Bias 5 summary results, and wow, Botswana should be look, I got to give my people some drums. I got to keep my Botswana, well done. Leboga, well done. You know, like I say, this is so important for Botswana to understand that we're not saying that it's all on PEPFAR. We're not saying that it's all on the American people, but you, the Republic, the biggest stakeholder of Botswana, PTY LT, you, the Botswana, did a phenomenal job. Walk us through.
Yes, that is it. You did an excellent job. Everybody on the line, I hope you hear, you did an excellent job. So we have a reason to be proud.
Absolutely.
So I think back to 2001 when then President of Botswana, Dr. Festus Mogae, stated, we really are in a national crisis. We are threatened with extinction. Mm-hmm. He said people are dying with chillingly high numbers. We're losing the best of young people. It is a crisis of the first magnitude.
Sorry, Yemi. Let me just take this call. Gabs FM, good morning. How are you?
Good morning, Swift. Mae.
Hello, Mae. Hello, mothers.
Yes, I just want to commend His Excellency's ambassador and his colleagues there.
Thank you.
Amazing work that they've done over the years.
Absolutely.
But I also want to emphasize what you are saying. Partnerships is key.
Absolutely.
With the key population, with the communities. And I want to emphasize, I'm from civil society. Civil society played an instrumental role as well in partnership with government, the churches, the different organizations, Bouquet, Bonaso, all those. So your partnerships are very key. And I sat on the group for a while from the Anglican Diocese perspective. It's Elsie Alexander, by the way. And I enjoyed, and it was very, very positive to see how this partnership unfolded and how the strategy was informed by the people themselves that were directly affected.
Wow.
And it is a role model. It's a model program that all of us need to look at and adopt in assisting the communities. And I even said during COVID, this would have been the best practice to use to deal with our COVID issue. So well done, PEPFAR. Well done, Embassy and civil society, government and private sector. Thank you.
Thank you, Ma. Hey, nothing but love for you. Thank you so much. Wow, you've heard it from the horses, Ma. And let me tell you something. We have the Ministry of Health in the building. We're also going to hear from a different voice. And of course, that goes to show. Look, sorry, Yemi, I disturbed you while you were answering the previous question. You can go ahead.
No worries. That was the best disruption
Yeah.
because it was a disruption that talks about the importance of collaboration. And she hit the nail on the head.
Mm-hmm.
Civil society is key.
Yeah.
The faith communities, KP populations, youth, adolescent girls and young women. I mean, they're the ones who did the work over these 20 years. It's not us alone. It's not the money alone either.
Yes.
It is the people who are on the ground, who are partnering with government to make a change. So thank you for acknowledging that and continuing to remind us. This is a celebration not just for us. This is something we all should be celebrating together. So we talked earlier about the words of the great Dr. Festus Mogae.
Yes.
And that represented in 2001 a really chilling environment and reality. But now let's jump to last year in 2022 when we celebrated the results of the Botswana AIDS Impact Survey, or BIAS-5, which showed that 95% of people living with HIV in Botswana were aware of their status. 98% of those people that are aware of their status were on antiretroviral therapy or on treatment. And 98% of those people who are on treatment achieved viral load suppression.
You gotta do the drum.
Come on.
Yemi, you brought out the drums.
3 times, y'all.
Wow. And the thing is, jokes aside, that is amazing. HIV and AIDS, just on your mental health, it deteriorates people. You know what I'm saying? So the fact that we've achieved that together is huge. And that's why this year, 20 years of PEPFAR in Botswana is a big deal. Botswana need to understand that. Botswana need to celebrate that. Go back. Get those old stories about what it was like in the olden days so that you can appreciate what you have today.
Exactly. And for us, again, that is a huge win. One of the first countries in the world to get to that place. And Swift, if you don't mind, can I share a few other wins? From
No
the last 20 years?
worries.
All right. So the country's Treat All strategy comes to the forefront of my mind. It was instrumental in reinvigorating the HIV response in Botswana and contributed positively to the decreases in new HIV infections, as well as decreases in HIV-related deaths.
Hello.
And from our perspective, it saved the country money. So I also think about the many successes that have taken place within the health systems, from supporting the training of healthcare workers to making sure that that testing and treatment services were decentralized to ensure that they were made available to everyone throughout the country, even in the most remote areas. I also think of the support for infrastructure like laboratories, which has also been critical to HIV response. For example, at the start of the epidemic, testing, monitoring, and surveillance of the response was carried out by only one laboratory in the country. But today, there are 24 laboratories across Botswana that offer viral load testing.
That is amazing. Unfortunately, we're fast running out of time, Yemi. Let me give you this opportunity to share your parting statement. You've done, whether we like it or not, this collaboration is important. Well done to PEPFAR. Well done to every single health worker in the Republic of Botswana. Whether you're American or not, I'd like to sincerely thank you to all the health workers. I think we need to have a National Health Worker Day.
Exactly.
Where it's actually a holiday, because you underestimate what the health worker does. The nurse that comes and sees you and takes your blood pressure and advises you, you underestimate the psychological impact on what they do. There's no day off on health. There's no Christmas Day. There's no Happy Easter. No, but we have health workers at every single clinic around this country doing so much for the health and, of course, the vitality of our nation. And that is so important. Shout out to the health worker. Absolutely. Shout out to the health worker. Your last words before we love and leave you?
So I'll leave you with two different words. The first is it's back to what our sister was saying earlier, the one who called in.
Yes.
Her words reminded me of a saying that I've heard since I've come to Botswana.
Okay.
Now I may screw it up a little bit because Botswana is pretty, but Maboho Dinku Atebana, which
beautiful.
I understand to mean that when there are more hands, the work is done. It's all about the collaboration. And the last thing I'll say is we need to continue to celebrate for this whole year. And we encourage everybody to celebrate with us. We're planning a number of events this year, from a billboard campaign to artistic competitions to murals, to help commemorate the 20th anniversary. So please stay tuned.
Hashtag PEPFAR at 20. And you got to follow all the U.S. Embassy social media pages to be a part and parcel of this great anniversary. Shout out to the U.S. Embassy. Shout out to the Botswana people. Shout out to the U.S. government and, of course, the BW government. But we cannot have this show without speaking to the custodian of health, which is the Ministry of Health in Botswana. And, of course, to shed light on this, I have Dr. Nkomo Bonaparte in the building. Sir, how are you? You can't have this impact without the Ministry of Health. And you guys have done an amazing job. The last, looking back over the last 20 years of the HIV response in Botswana, walk us through, especially the youth. Maybe the youth, where you are coming from, and you've been part and parcel of it for the last 20 years. Walk us through that.
Thank you, sir, and good morning to everyone out there. So, yes, indeed, I think the 20 years have been very dramatic, and there have been a lot of achievements. So we have seen, in epidemiology, we say reduction in mortality, but that is the reduction in the deaths.
Yes.
As you say, the young ones may not have seen a lot of people dying from HIV, but some of us who are a bit elderly saw those deaths. So when PEPFAR came in, we were having about 15,000 deaths in a year.
Jeez, that's a big number.
In a year in Botswana. But no, now we are down to less than 4,000.
Wow.
So that's a major achievement.
That's definitely, yes.
In view of our programs. Also, in terms of illness, a lot of people were out there ill. Hospitals were flooded. We ended up taking people for home-based care. But now, as we speak, we don't have hospitals flooded with sick people. People are just attending clinics, and to that, they are even coming to the clinics maybe even once every 3 months or once every 6 months. So I think that's a major achievement as far as the HIV response is concerned. And the other thing, the quality of life has very much improved.
Absolutely.
Yes, our life expectancy has gone back to the normal of people are living their normal life of up to 70 plus years, whereas in the past the life expectancy really was around the 30s. And we know that now our communities are very productive. They don't have to spend a lot of time at hospitals. In the past, people would diagnose sick people in the streets, but today you cannot go about diagnosing anybody of having HIV anyway because of our successes. And I think finally, really, they've talked to the economic productivity.
Yeah, actually, I didn't think of that. Yes.
And so as our people are healthier, they are out there, productive, working, taking care of those who are dependent on them because they can manage it. So I think those are some of the major achievements and impacts that we have had with the response.
Actually, allow me to bring in Catherine Motswere Chirwa into the conversation. She is the PMTCT program officer. I think you would also offer value into the conversation so that we can both, touch on different perspectives of this conversation. Doc, look, you've got to be incredibly smart. So I want to learn from yourself, your history, your wisdom. What was Botswana like? Walk us through your journey in line with HIV and AIDS. Outside of what you do for a living, walk us through that component.
Oh, sure, Swift. Thank you so much for having me. And good morning to your listeners. I'm just happy to be here representing our technical team, the PEPFAR technical team.
Shout out to PEPFAR technical team. If you're hearing us in the office, I need you to scream.
Sure.
Yes.
Sure. My journey with PEPFAR started 18 years ago. 18 years ago, just 2 years after
the initiative
was banned.
Wow.
It's been a journey for me, a wonderful journey, of course. And my main job is working as a program manager is to, managing the cooperative agreement for the government of Botswana and also our implementing partners. And for the 18 years of working for this incredible organization, I've been part of I've seen major changes from those years until now that have taken place over the years. And to be honest, I'm here because we are just supporting the government. As PMTCT manager, I want to ensure that we save the lives of our children. No child is to be born with HIV.
No child.
That is our aim. And the next thing is to ensure that, pregnant mothers, their families have access.
And one thing that
and treatment.
One thing that comes to mind is PEPFAR also works with sex workers,
Sure.
and that is important. Whether it's an important component of our everyday. Sex workers are part and parcel of our communities. They are mothers, they are our aunts, they are our sisters, they are our daughters.
That's very true. To be honest, right now, as we speak, through consistent advocacy and communication to policymaker, to Dr. Nkomo, and the community at large, PEPFAR Botswana facilitated major changes in services that are provided to key populations that include sex workers, that include prisoners, transgenders, people using drugs. We are so much advocating for all this our key populations. And as you rightly know, that HIV services to non-citizens also has been adopted by the government of Botswana.
We have to give my government some drums.
Sure.
Just hold on. Just hold on. The 267, well done. You know, at the end of the day, you can underestimate that, but it's not easy being a foreigner in any country, and especially undocumented, and you have a health challenge. So the fact that the BW government, PEPFAR, the US people have come together to say, look, let's not deny a health solution to a person because of their status or whether they have immigration paperwork or not. So that is amazing. Absolutely.
Services available in all public facilities and accessible even to non-citizens living in this country, you know. And I also wanted to touch on a number of prevention programs, you know, that includes DREAMS, like you rightfully said, PrEP, VMMC, cervical cancer. You know, with our DREAMS program, which targets adolescents and young girls aged 10 to 14 years of age, you know, we seek to empower the girls by providing layers of support, including livelihood skills, you know, using specific curriculum delivered to our young people in a very safe space.
Yes.
You know, the other important thing that I also wanted to, you know, talk to is with the services that we provide even for our military, you know, the BDF.
Yes.
We managed to support the BDF through PEPFAR Department of Defense in reducing HIV infection through introduction of the Squatter campaign.
Wow.
If you remember the Squatter camouflage.
Yes. I've got cousins who are soldiers, so they always say, hey, Squatter.
Yes.
Yeah. Okay.
And they're very much popular. The condoms, the Squatter camouflage condoms are very popular.
Wow.
You know. And I think I also want to touch on some of the prevention, you know, programs. For example, in the year 2018 and financial year 2022, we have managed to support cervical cancer, you know, screening, of which 66,000 women living with HIV, of which 3,900 were HIV positive, were provided treatment for cancer. That's over 3,000 lives saved in a space of 4 or 5 years. Wow. Bravo to PEPFAR Botswana. Bravo to government of Botswana.
Well, let's do the drums one more time.
You know, there's no how I cannot talk about health system strengthening.
Yes.
You know, as PEPFAR Botswana, we have supported health system strengthening, like Ayemi rightfully said, in the area of monitoring and evaluation, surveillance, you know, statistics and health information systems, you know, to the government as well as to our civil societies. We also support the implementation of electronic register to capture HIV data. You know, this is very much aligned to the vision of the government of Botswana of digitalizing the public sector for more efficient service delivery.
Wow. Well, it's Gabs FM, power to engage your world. You're on the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM, # America in Botswana. Allow me to bring Dr. Nkomo back into the conversation. Look, looking back, what are some of the efforts that the government is most proud of, the milestones to end HIV and AIDS as a public health threat in Botswana? Just walk us through those nostalgic milestones that we have achieved.
Now, thank you very much once more. So I think one of the most important things that government in partnership with the other stakeholders, including PEPFAR, has done is to bring universal health coverage to the country. You can almost get HIV services in any health facility throughout the country.
Wow.
And I think that's very important.
That is big. That is major.
And also, services are provided to anyone, be they citizen or non-citizen, as you earlier on said.
Yes.
And the other thing is that HIV services really for the population are almost free, even though they are not free for the government. I think that's important. And then also, I think other things that's important is prevention efforts. We are working very hard to make sure that people those who are HIV negative, stay HIV negative. And we are following the 5 pillars that the globe recognizes as programs for the young girls, programs for key populations, use of condoms, the new PrEP that we have started providing, ARVs being used for prevention, and also the circumcision program.
You know, Dr. Nkoma, a milestone that I remember, because I was a teenager and, coming into my sexuality at that time. And I remember free condoms. I remember that, and not only just any brand, I remember Durex, I remember free condoms being available, and my old man came in and we had that conversation about, sex, and he brought me a box and said, young man, please make sure and ensure that you're protecting yourself. And whether we like it or not, this kind of education, we need to have these conversations. Yes, beyond it, we've achieved a great lot, but the fight is not over. We must understand that it is not a time to be complacent. Yeah. It is a time to push forward. It is a time to educate each other. And that is what this bilateral relationship means. That's why the Ministry of Health is in the building, PEPFAR is in the building, and we're all having this open conversation to say, look, this is not about only celebrating, but understanding that there's still another battle to fight. We want to eradicate it completely. And that is the objective. Look, Catherine, can I bring you back into the conversation? 18 years. Wow. I got to give you the drums. Over the 18 years, I remember HIV to be psychologically draining. I remember, I'm sure you've seen and fallen in love or gotten attached to people that have unfortunately lost their lives. You have seen the infrastructure come together from black and white piece and paper to seeing, clinics, to seeing various campaigns. Just touch us on just walk on that in your closing statement, especially for the citizen, the young person, to understand what this means to all of us.
To be honest, as an individual,
Emma,
it's important, throughout our career to ask ourselves, why are we doing what we're doing? Are we doing it for money?
Yes.
Or are we doing it as a calling? Something that we are passionate about.
I like that, yes. It's
a great question, honestly. And for me, I believe this is a calling that has started long, even before 18 years ago, Through this, all of us here, we have endured so much pain. We have seen it all and so much grief. And we lost our friends. We lost relatives and colleagues. But this great collaboration that we are having for the past 20 years, you can imagine, has brought so much hope. Hope for the nation of Botswana. We were hopeless at one point. Right now, as we speak, we have so much hope for the future.
Absolutely.
For our children. And like you said, it's not ending here. It's not stopping here. We still have a way to go. For example, PMT City, we got silver.
Hello.
We're aiming for gold.
Yes.
As a nation, we are going for our goal.
Absolutely.
We really want to curb this disease and ensure that none of our children, none, is born with HIV.
No child will be left.
No child will be left. Nobody will be left. No non-citizen will be left.
I like that.
Key population. We are in this together.
I love it.
And we are winning.
I like that. Dr. Nkomo, your last words to the nation.
Well, my last words are that together we will achieve more. We say that's what the word team stands for. So
yes.
Without partnership, without civil society, without the general population, we can't achieve. So together we can achieve more.
Sure.
Well, kings and queens and young people, young adults, go and get yourself tested. Go and know your HIV status. Appreciate. Please go out, speak to the elderly and say, Mama, Papa, what was it like in the 90s? Talk to me and share those stories, because then you'll understand. We're closing the show with a song by the late, great drummer boy who lost his life, unfortunately, to this filthy disease. But it is an example. His name shall live on forever. It shall live on as an example of the importance of this bilateral relationship. Shared health. Shout out to the U.S. government. Shout out to the American people, the BW government, the Ministry of Health. Ladies and gentlemen, good morning.
The Stars and Stripes show was brought to you by the U.S. Embassy.